Mpox has been endemic in the Democratic Republic of Congo for more than a decade. But two likely related changes have been causing increasing concern. A sharp rise in cases and a new subvariant of the disease's more dangerous type. In Geneva last night, the head of the World Health Organization declared a public health emergency of international concern, the highest possible designation.
It's clear that a coordinated international response is essential to stop these outbreaks and save lives.
A relative of the eradicated smallpox virus, Mpox, formerly monkeypox, causes fever and painful lesions and is divided into two broad types, clade 1 and clade 2. Both are spread through close contact, including sex. Clade 1 is the form endemic in the Democratic Republic of Congo and is by far the more dangerous, fatal in up to 10% of cases in children. Last October, a new variant, clade 1b, was detected. Epidemiologists are working to discern whether it fueled the increase in cases in the east of the country.
We're talking about a population of barely 2 million, plus almost an extra million of displaced population. So we are worried about not only the size of the people, but as well the living conditions of part of this population that pretty much cramped in camps, where the transmission can be quicker.
So far this year, the Democratic Republic of Congo has recorded 15,600 cases of Mpox, a 160% rise on the same period last year. That's resulted in more than 500 deaths, up by nearly a fifth. The country has more than 96% of Africa's cases, but the disease is spreading into new territory, with Rwanda, Burundi, Uganda and Kenya all reporting their first ever cases.
Sometimes you get truck drivers coming all the way from East African ports, that is Mombasa and Dar es Salaam, and going all the way crossing countries like Tanzania, Kenya, Uganda, Rwanda to enter into Eastern DRC. We need to understand which groups of people are at risk: healthcare workers, sex workers, and many other groups of people, but also work on including everyone, so that we don't have the type of stigma that people had the beginning of, let's say, HIV in the early 90s.
The milder clade 2 form of Mpox, endemic in West Africa, was the focus of the last global emergency in 2022, when cases were reported around the world, largely affecting gay and bisexual men. Its spread dwindled after a vaccination drive and a public health campaign. But today's confirmation of Sweden's first clade 1 case will fuel questions about the lack of vaccine made available earlier in Africa. The continent's Centre for Disease Control says it now needs 10 million doses and $4 billion to fight the virus. Funding pledges from the African Union and WHO so far total less than 12 million.
Well, I'm joined now by Save the Children's Democratic Republic of the Congo's country director, Greg Ram. And we heard in Harry's report there, 96% of the cases and deaths are where you are in the Democratic Republic of Congo. How grave is the situation?
Well, the situation is very serious here. The disease is growing, it is spreading, and the majority of people who are getting the disease and the majority of people who are dying are children. And we are very concerned about that.
How has it been spreading? Because we've been hearing about these trucker routes where there are truckers and sex workers, and that's carrying it beyond communities, beyond borders.
Well, what's happening here in Eastern Congo is it's spreading more communally. So it's spreading in families. It is clearly contagious within families through close contact. More than 7 million people in the Congo are internally displaced, living in crowded conditions, often in displacement camps. And it's very easy for a disease like this to spread through close contact in those situations.
How concerning is this new strain, this new variant?
Well, each strain has its own aspects, and I know that the health researchers are looking carefully at those. Both strains are prevalent here in the Congo and are at risk of spreading further. We're particularly concerned about those that are spreading in Eastern Congo in the displacement camps in places where there's already a severe humanitarian crisis, where health systems are overstretched, and where children are getting it through contact in their community with friends, with family. And that's what we need to really address in the first instance.
This has been going on in the Democratic Republic of Congo, though, hasn't it, for some time? There's been hundreds of deaths last year also.
Well, as mentioned in your earlier report, it is Mpox is endemic here. What we're seeing now is higher death rates and higher case rates than we've seen in a very long time. And and as you've noted, it also has spread both in the region and now beyond the continent. And therefore, what's most important is try to address it at its source, here in the Congo, where children and their families need help, need protection.
Are you getting that support to address it at source? Are you getting the vaccinations?
Well, in the first instance, right at the moment, there are not enough. There are very few vaccinations here, and many more vaccinations need to be produced and need to be brought here to the Congo and given to people, particularly those are most vulnerable, the health workers, the nurses and the doctors we work with, who are the front line of this disease and who are not being protected. But in the absence of vaccine, there are many more things we can do. We can make sure that health clinics are safe, that they receive the infection control required, that health workers, the nurses the community health workers have protective gear. We can get out accurate messages about what it takes to stop the spread of this disease.
There was an outbreak in 2022 as well, wasn't there? And the world at first didn't seem to do much to help Africa. Do you think we're making the same mistakes? Why isn't the world stepping up?
It's a very common problem, isn't it? Until it's on your doorstep, you often don't pay much attention. At Save the Children, we work around the world wherever the children are in greatest need, and we believe that all children have a right to a basic childhood, to live and to grow and to thrive. And it's diseases like this that is often ignored, that needs attention, that needs support, that needs help. And it's sad that it takes a case spreading through around the world to get attention, but that still is a good thing when that happens.
And just briefly, based on what you've seen of how contagious this new variant is in Africa, how concerned should Europe be that it will spread here too?
I think what we found is that when messages get out in Europe, it can be much more easily controlled with the health resources that are there. The much greater concern is in those places where the health systems are much, much weaker and where there's already other diseases such as malaria, children dying of malnutrition, and that's where the focus of our energy needs to be.
Okay, Greg Ram from Save the Children, thanks for your time. Appreciate it.